Good morning, good evening, wherever you're watching from. My name is Jackson Muindi, and I want to give you information about how you can become a nurse in the UK with your non-nursing degree, or yeah, let's say your non-nursing degree. So, if you have your nursing degree from whichever field, whichever university, provided it's a nursing degree, just know that you can go to the UK and become a nurse in the UK through the NHS because this is because most UK university has a what we call a program which provides a pathway for people who have whatever kind of degree to go fast and become nurses in the UK. So if you are new to this channel, I just implore you to make sure that you are subscribed. Just turn on the notification bell if it's not turned on, so that whenever I post a video, you're among the first people to be notified. So I came across this program whereby any person with a degree doesn't require the IELTS exam, doesn't require to do all the other things like registration with NMC to go and study nursing in the UK. So what you need is your first degree, your passport, and maybe the vaccinations. Then you apply for these UK universities which are offering nursing degrees, and there are so many universities in the UK offering nursing degrees. So it's about you. You just need to go there and search and look for the one which suits you and apply for it. So the process might take around 4 to 6 months from the date of application to this degree course up until the day you get your visa and fly to the UK. So what does this program entail? It entails you taking your degree to those UK universities, and they check whether it has the hours they require for you to be able to convert that that non-nursing degree to the hours they require. So it also requires that you have some public experience. Maybe you've been working in an office, maybe you've been working as a teacher, maybe you've been working as an anything else. So this information, this experience translates into public service hours which you've been serving the public, and it is transferable to the UK university. They're able to understand that you've been working, you've been getting the experience, the exposure. So also the clinical rotation time will be reduced to fewer hours. So they'll require you that to have some theory hours and some theory and some experience exposure. So how do you get the theory hours? The theory hours are gotten from the hours you are in university. So that is counts as theory hours. So you send your degree and transcript to the university. They're able to see and verify that you've been in college. So again, how do you get the practical hours to show that with your nursing degree you've been getting the exposure? What they say is that they require you to get someone who is maybe a nurse, a registered nurse in your country, or someone of the authority in your country, to show that you have been working with them maybe for 3-4 years, and that will translate into the experience they'll need. So you find that this nursing degree, you'll do it for, let's say, like you do it for 2 hours, for 2 years. It's mostly 2 years, but some university cap it at 2.5 years. So I would advise someone who is willing to go through this route to look for degrees which offer this program for 2 years. I know people are asking about the cost, but let me tackle that later. But now let me talk about the English requirement. As you know, for most nurses to transition to the UK, you need to have the English exam, which is the IELTS. And for this route, which you require just to have your degree, whichever degree you have, you need to do the IELTS exam. Most universities require you to do the IELTS exam, but the band score required is quite low, because the band score required is 6.0 to 6.5 in the IELTS academic exam. So If you still intend to make sure, if you intend to do this degree, make sure that you pass your IELTS. You get at least 6.0 overall or 6.5. It will vary slightly with the universities. So unless there is someone in this live who has a question, I think I'm trying to answer these questions. But that is what I know. I know people asking about the universities. Just go to Google and look at University of Middle East. Let me attach the names of the university and the links, so that you just need to go and click the link. Then they'll take you directly to those universities. So guys, don't stay with your degree if it's not helping you in maybe in Africa, in Kenya, in Uganda, in Tanzania, in Nigeria, in Ghana. Just know that you can transition to the UK and do your nursing degree from there. So guys, some people are saying that their degree are not helping them. I know, but there's a way for you to transition to other countries, and that is one fine way. You can run with it. It has been there for long, but it's just that people have not known whether you can do it. And nursing is a very respected profession abroad. So I know there's a worldwide need for nurses. So this is the right time to change your career and go and do nursing in the UK, because the pay is good when you already get the PIN, because the UK NHS, NMC, I mean the NMC, once they give you the PIN, you become PINed, and you're able to earn good money when you get employed either in the NHS or the private care homes or private hospitals, whichever you get. So guys, don't say that there are no jobs, there are no schools and pathways for you to go to the UK. So the other thing is about the fees. I know it's for international students, it might be a little bit expensive, because you need 15,000 euros, which if you convert to your own currency, it might be a little bit expensive. But I know there are people who have this kind of money and they are willing to transition to the UK and bear with these 2 years. And once they finish, they get it's a sure thing that you'll become pinned and start practicing as a nurse in the UK without getting the high band score for the IELTS which are required. So I don't know whether there's someone in the live with any question. I know people they feel the pinch because of the high fees, coupled together with the accommodation and other expenses. The money you need, it's not an easy thing, but we can always try. So for people who have money, who have the financial resources, I mean, you can always try out these pathways when they come, because some of them get reviewed from time to time, and you might find that they are not there. So guys, I know the NMC is doing some review of its English requirement scores. So for nurses who are here and they want to know about the IELTS exam, just know that the NMC is doing a review, and by October of this year, which is we are now in May 31st, just know that by October of this year, 2022, we'll be having a review of the English exam requirements. They might lower it, and there is a petition to completely remove the requirement for doing the IELTS exam, because there's a talk about the IELTS not being a measure of your intelligence. So if you can just go and look for the petition and sign it to push the NMC to remove it. We are praying for it to be removed completely, because I know there are people who can practice well in the UK as nurses. So guys, again, if you are not subscribed to this channel, make sure that you subscribe and watch other videos in this channel. They are linked here. For the people who have been able to come live, thank you for that. We can always link up either here or TikTok. So thank you guys, and have a good day.